Inside Texas Politics with Jason Whiteley starts now.
Good morning. Coming to you from downtown Dallas, I'm Jason Wheeler in for Jason Whiteley this week. Before we sit down with our first guest, as always, we're getting you caught up on some of the political highlights that we're watching today. Governor Abbott is considering a state takeover of the Austin Police Department. The governor tweeted Friday saying this in response to the city's decision to move money away from the police department to other services. Under the governor's plan, Austin Police could be consolidated under DPS, but that proposal would still need to pass the state legislature. The chairman of HEB is stepping into the controversy over mail-in ballots. Charles Butt wrote a letter to the Supreme Court of Texas siding with the Harris County clerk who wanted to send mail-in ballot applications to every eligible voter in the county. Republican State Attorney General Ken Paxton said the plan was against the law and unsafe, and that the Texas Supreme Court then blocked that proposal. But Charles Butt says it's the safe way to protect people from coronavirus. By the way, the Harris County clerk does plan to send mail-in ballot applications to voters age 65 and older and those who are disabled. Those people are allowed to vote by mail under Texas law. Texas is spending $15 million on an advertising campaign to get more people to fill out the census. Right now, a little under 80% of households have responded. Counting for the census ends soon on September 30th. Well, the CDC is telling states to get ready for a coronavirus vaccine as early as the week of the election. Some experts say that's an impossible timeline to deliver a vaccine that is fully tested and known to be safe and effective. And there are worries that politics could influence science here. So we went straight to the FDA commissioner, Dr. Hahn, to get his take on the record.
We've seen this splash of headlines here in recent days from the CDC telling different states across the country to get their infrastructure ready, to be ready to distribute a vaccine by November 1st. Of course, any authorization that happens, though, comes from you, from the FDA. Is that a realistic timeline that we could see a vaccine that early?
Jason, I want to be really clear about this one. I was a cancer doctor before I became FDA commissioner, and I don't have a crystal ball. And I will not and cannot predict when the data will come to us. Data have to mature from the phase 3 trials. They will be sent to us, and we will look at those data when they're available. I just can't forecast as to when they might be available. I think it's great to be prepared for any eventuality.
But just to put a fine point on it, without seeing the full set of data, you would be willing to go forward with an emergency use authorization if the initial data indicates that we're looking at a safe and effective vaccine.
We're going to be flexible in our approach, but we made clear in June what data we needed to see with respect to safety and efficacy, and we're sticking to those criteria.
As decision time for this draws near, let's say the pressure really starts to get intense for you here. How far are you personally willing to go? Are you willing to put your position on the line here to hold off and make sure that this vaccine does not happen until it is safe and effective?
Jason, I'm going to be, again, really clear about this one, and I have been before, and that is we will only make a decision on the basis of the science and data, and that no other criteria are going to be used.
We had a University of Texas Politics Project survey that was done in late June, and they found that even if a vaccine were available, 21% of people in that survey said they wouldn't get that vaccine, and another 20% on top of that said that they were unsure. How big of a concern is that to you?
So this is a concern for me and for the agency, because we want the American public to have confidence in the fact that we will use our rigorous criteria to judge the safety and efficacy of a vaccine. I think a couple of things, Jason, it's a really good question. One is when you look at how the process has been expedited, a couple things go into that. One is FDA has been doing what's called a rolling review, meaning that we're not just waiting for one part of this to be done and then to look at the data. We've been looking at it in real time, and that cuts down the review time without cutting corners. The second thing is that, as you know, manufacturers and the government have been what's called manufacturing at risk. So that they're already in the process of going through the manufacturing process so that vaccine can be available if a vaccine is either approved or authorized.
If you thought that it might encourage people to be more confident in a vaccine, if they are skittish about, let's say vaccines in general, would you be willing to be one of the first to get one of these just to show that, hey, I put my money where my mouth is here?
Based upon the decision of our FDA scientists, if they determine that this was safety and efficacy, I absolutely would do so.
Let me ask you about convalescent plasma, because you came out alongside the president, hailed this as a huge breakthrough, and then there was criticism that followed from some scientists saying that the data just wasn't there yet. You went on Twitter and said, hey, criticism justified here, and now we're in the stage of looking at more data. Do we need a lot more data before convalescent plasma is approved for widespread use as a treatment for COVID-19?
So, Jason, there's been an incredible demand over the last 4 to 5 months for convalescent plasma, and it continues. Our decision around the emergency use authorization, and I said this at the press conference, shows promising results. They're not definitive results, but they're promising results.
You have a big job right now. Before you took this on, you were the chief medical executive at the University of Texas MD Anderson Cancer Center in Houston, a renowned institution there. I'm curious, what did you pick up in that position? Because that's a big job too. What did you pick up in that position that is helping to inform how you go forward in the job you're in now?
So one of the things I learned in my previous job was to trust the doctors and the scientists. Because they'll lead you to the right answer for cancer patients. And I can tell you this, I trust the doctors, nurses, pharmacists, scientists at FDA, because they do know what they're doing. They are terrific individuals, and they, throughout the pandemic, have made excellent decisions on behalf of the American people.